It's the start of a promising week. Welcome to your most authoritative show on TV. It's The Pulse. It's coming to you live from our studios in Kokomlimle on your digital terrestrial TV, because we're free to air on DSTV channel 421 and GoTV channel 144. We are your home of independent, fearless and credible journalism. This afternoon, victims of the Upper West Region's Thursday floods to heave a sigh of relief as roads and highways Minister Kwesi Amoakwata assures the roads will be fixed after vehicles and passengers were stranded on sections of the highways due to the downpour. We are in Goriri this afternoon for more. Also this afternoon, health experts expressing worry as COVID fatalities in the country shoot up in the last 3 weeks, with current number of deaths shooting up to 930. We have details of fresh strategies adopted by the Ghana Health Service to deal with this new development.
Unfortunately, we've lost 344 and our active cases as of today is 818 cases.
Plus, the Youth and Employment Agency cited in the Auditor General's report for uncertified payments of 324 million cedis to Waste Management Company Zoomlion under the Youth in Sanitation module. On the Pulse this afternoon, we have details of the report, which also accuses the YEA of increasing the management fee with Zoomlion from 500 to 600 cedis. My name is Aisha Ibrahim. We're also live on all our social media handles, YouTube, Facebook. Remember, The Pulse is brought to you by Global Communities, Dignilu Affordable Safe Sanitation. Tweet at us at the hashtag The Pulse. My personal handle is at the Nana Aisha. Always a pleasure to host you. Let's begin this afternoon in the Upper West region, because Roads and Highways Minister Kwesi Amoakwata has pledged that the roads destroyed by floods in the Upper West region will be quickly fixed. Addressing journalists as he toured affected communities, he expressed relief that no life was lost and urged the chiefs and people of the region to be strong whilst government takes steps to fix the roads. 8 municipalities and districts have been cut off from the regional capital, with some residents also cut off from their district capitals. We will hear from the minister shortly, but first watch this report filed by our correspondent Rafiq Salam earlier on the situation.
More than 100 vehicles snaked at Goriri, majority being heavy trucks, heading to Burkina Faso as a result of Thursday's flash floods in the region that affected 6 districts and municipalities. However, the ripple effect of the torrential rain that lasted for over 12 hours is shared by all 11 municipal and districts in the region. The region has been sharply divided into 2 equal halves, with bridges located in some major highways completely washed away by the flash floods. One Rose area manager of the Ghana Highways Authority, Vivian Kankwe-Yang, painted a mental picture about the affected roads.
We have this particular section that we are standing on. That is the Wa Naduli section, and it is specifically at Goriri. And this is what we are saying. So it's cut off. Traveling from Wa to Naduli, you will not be able to pass through. And the next one is the Sombo, also on the Wa road, Wa to Nadoli road, Sombo to Dafiama. That one too has been cut off. A vehicle cannot ply the road unless maybe now the waters are down that pedestrians can pass. The other cut off is ahead, Nadoli to Babli at Yizere. That one is the very serious one that we have seen.
The Kululu River at Goriri in the Nodulu-Keleo district broke its banks, cutting off the district into 2 halves, and also the linking the Lora, Nandom, and Jiriba municipalities from the regional capital. Bearing the brand already is the Nodulu-Keleo district chief executive, Catherine Lankono, who is cut off from her district capital. Her story appears like the biblical Moses who saw Canaan but couldn't reach there. Her office is some 3 kilometers away from the 3 broken culverts. For her to access her office now, she needs to make a detour of over 50 kilometers.
Terrible, because if we have urgent issues to deal with, it means that we have to put those on hold. If you have dissect, you have anything that is of emergency, it means that we cannot hold those activities until further notice.
Though not of the same magnitude, the Sisal East municipality, which is arguably the leading producers of maize in the country, according to its municipal chief executive, Karim Nanyo, also has a share of the violent flash floods.
So unfortunately, if you have rains and then you are not able to move about with your daily activity, it's actually something that is worrying us. Besides that, you further realize that most of the roads has been destroyed, and it's going to be a permanent turn. Even yesterday, because of the rain, we couldn't go out. Today, there's no rain, but we could not go out because there are no roads for people to move their farm inputs about.
Upper West Regional Minister Dr. Hafiz bin Sali used a two-pronged style to assess the situation. First, by joining the helicopter together with some RECSEC members to have an aerial view, and later driving to some of the areas to see the situation for himself on the ground. Videos taken inside the helicopter showed broken bridges, sea of farms, and economic trees submerged in water, and small rivers near some communities drastically widened. Dr. Bin Sali has a strong conviction that the roads will be fixed, but has no time frame.
What has happened has taken the Upper West backwards, and it will need massive intervention for us to go back or to get back to where we were about 3 or 4 days ago. But I can assure you that government will do everything within its power to work on the routes so that we get good roads in the Upper West region.
The extent and cost of the disaster for now is still unknown, as the National Disaster Management Organization, NADMO, are unable to reach the affected communities.
Reporting for JoyNews, Rafik Salam, Goriyiri.
Rafik Salam has been monitoring the minister and his team, who have been visiting areas of the flood and also assessing the extent of damage. He joins us shortly via Zoom for that. Rafik, what more can you tell us about the minister's visit? Where and where has he visited so far? Hello, Rafik. Unmute for me. And if you can hear me, I'm asking where, which areas the minister has visited.
The minister landed at Wa this morning, and so the first thing that he did was to hold a press conference to show his sympathy, his remorse for the people of the Upper West region regarding the floods that happened in the region. And he says that the pictures or the videos that he had saw as enormous, but he thinks that it is not something that is beyond their capability. Move to all the affected areas, starting from Goriyiri and then ended around the River Wahabu. And so he came back to Wa, and after that, he held another press conference to tell the JoyNews that they are on top of the issues, and then they are going to hold an emergency meeting in Accra and next Monday, because he thinks that it's a national emergency issue, and it will be treated with all the seriousness that it deserves. And then after that, he went and paid homage to the overlord of the Wala Kingdom, Nafu at the form. And so the minister, as I speak to you now, is currently on his way back to Accra.
Now, the minister assured the people that the affected roads will be fixed. How soon?
He didn't give any timeline regarding when these roads will be fixed. But he stated categorically that who has been in this region for over 60 years, and he's saying that he's a very good contractor. He's the one that will lead the charge in trying to fix these particular roads. But the minister also made one important observation, which has to deal with the nature of the disaster. He's saying that he's happy that the culverts or bridges, though the grounds, the roads were washed away, but the culverts and bridges were intact. That clearly means that there was a lot of good work that was done on these bridges. Unfortunately, it's the same contractor who did these roads close to 30 years ago. He's the one that is going to lead the charge for now. But the minister, he didn't give timelines as when this roads will affect. But he's saying that the whole country, 2 weeks, within 2 weeks, go back to the Upper West region to see things for himself and see how things are going.
Let's listen to the Roads and Highways Minister when he toured those areas.
Including all the noble chiefs should be strong. Know that His Excellency the President and the government will not allow any part of this country to go through suffering. And we do not want to see any part of our country cut off from the rest. Yes, what has happened is unfortunate. What has happened could qualify to be described as a disaster. It has affected a lot of facilities, particularly the road infrastructure. But everybody should know that what has been destroyed is not beyond human solution. It's not beyond human capability. And the government is behind every part of this country, including this great region. Yes, there has been massive destruction, but the affected roads are going to be fixed in a record time. The government is going to mobilize all available resources to fix what has gone wrong.
Rafik, how are the affected victims receiving this?
I can tell you that Aisha, it's like living in hell in some parts of the Upper West region. And so some places it's just a place, it's just not for the faint-hearted. I visited Agoriri today, and I can see a sea of people trying to cross from one end to the other, and it's really difficult. And also, one thing worth noting is that transport fares in the region has also increased astronomically. It has even been tripled. Let me cite an instance. A place like Jirba used to go for 20 cities. Now, for you to be at Jirba, it's either between 50 and 60 Ghana cedis. And so, transport fares in the region is now going higher. And then one also issue which we have to deal with, swollen rivers and then lakes. You have places that you know that the roads are about caving in, and at the prayer of the minister and other people.
All right, we lost Rafik Salam there, bad internet connection on his side. But if he comes back, he'll also be telling us what the situation is right now and whether relief items are enough for the victims. But Upper West Regional Minister has also been speaking.
Has come to see the situation for himself, so as the necessary measures will be put in place to redeem the situation. So I have the pleasure to welcome Honorable Minister for Roads and Highways and officials of this ministry to the Upper West. My uncle, you are welcome.
Rafik Salam, so what can you say about relief items? Enough for the victims?
For now, there's no relief items, Aisha, for the victims, because they themselves have not been able to assess some of the areas. They have not been able to get to the affected areas because they are cut off. Interestingly, Interestingly, one of their warehouses, the regional warehouses, is located in the middle belt of the region, and so NADMO itself cannot have access to this warehouse.
Rafiq Salam with the updates from the Upper West region, Guriri to be specific. Now, the Auditor General has cited the Youth Employment Agency of uncertified payment of 324 million cedis to waste management company Zoomlion under the Youth in Sanitation module. According to the audit report of district assemblies, the payment under the instruction of the executive director was done without documentation. The agency is also accused of increasing the management fee with Zoomlion from 500 to 600 cedis, covering 45,000 employees. We have a response from the Chief Executive Officer of the YEA, Justin Kodia. But first, my colleague Elton Broby joins me on phone with more from the audit findings. Elton, what can you tell us about these findings?
So, Aisha, this is the audited account on the utilization of the District Assembly's Common Fund. So, under YEA, they have this sanitation model contract with Zoomlion Ghana Limited. Now, there are three issues that the Auditor General highlighted as infractions against the Youth Employment Agency. One is the upward adjustment of the management fee from 500 Ghana cedis per person to 600 Ghana cedis. Also, the recruitment of the youth under the model, 45,000 of them, and the fact that the Auditor General says that he was unable to authenticate the employment contract. And lastly, the payment of 324 million Ghana cedis, Zoomlion Ghana Limited, which the Auditor General says that he could not trade documentary evidence backing that particular payment. And he wants the administrator of the Common Fund to stop further payment to Zoomlion until the Youth Employment Agency is able to validate the payment, one. Secondly, to provide employment contract covering all the 45,000 individuals employed under the sanitation model, and then thirdly, to justify the increment from 500 Ghana cedis to 600 Ghana cedis as management contract covering the youth in sanitation model, which the administrator pays to Zoomlion as management fees on an annually basis.
Elton Brobe with the details from the Auditor General's report. Now, the YEA Chief Executive Officer, Justin Kodia, has a response.
This document is the contract document between YEA and Zoomlion Ghana Limited. And I can make a copy for you. You can have a view of the contract arrangement between us. I quite remember the auditors came to see us as part of their audit of the District Assembly Common Fund. And the contract document was given to them. So I'm very surprised if someone should say that he or she has not cited that document. And two, the issue about the 500 to 600. Before 2014, the amount that was paid per beneficiary for the sanitation model was 320 Ghana cedis. And from 2014, it has been 500 Ghana cedis, 100 cedis to the beneficiaries, and 400 cedis as management fees. So when we assumed office administration in 2017, one, there was no proper documentation or contract between the YEA and Zoomlion Ghana Limited. So we wrote to Attorney General for advice whether there was a contract, because we couldn't cite any formal document. And the Attorney General advice was based on the conduct of the two parties, where a person works and you pay the person. Then definitely there's a contract between the two parties. But however, we should take steps to regularize the whole processes. And that is how this contract came about. During the discussions with, after going through the PPA, and PPA giving us a green light to look at the amount that was being paid, someone was charging 500 cedis from 2014, and we were in 2019. You take into consideration inflation, you take into consideration the cost of items. Definitely, there was no way the 500 was going to hold. We needed to review it. But on the part of YE, we decided to do due diligence, because in the past it was placed that beneficiaries get 100 cedis, the service provider gets 400 as management fee. But we were not comfortable with it. We thought that the amount that was being paid to the beneficiaries was woefully inadequate. So we, through discussion and negotiation, added 80 Ghana cedis more to what the beneficiaries were getting to make it 180. Then the service provider had the 20 cedis as additional a negotiation bill for them. So from 2014 to 2019, the only thing that had been added to the service provider is 20 cedis per beneficiary. But however, we went further to state that when you talk about management fees is vague. We know there are logistics components and there's what you are charging as management fee. So let's break it down. How much are you going to charge as management fees and how much is going to go into logistics? Right. When you talk about logistics, it has to do with the uniform that the beneficiaries wear, the Wellington boots, the brooms, the wheelbarrows, and after cleaning the road, there has to be a truck that will have to come and pick it, moving it from the picking point to the dumping site. All these were factored into to constitute the logistics.
It's also been speaking about the payment of 324 million cedis to Zoomlion without supporting document.
And that one too, I'm really surprised because the last letter we received from the Auditor General, signed by Mr. Samuel Boateng-Asare, was confirmation of works, goods and services paid for from District Assembly Common Fund. And I may read for the purposes of that discussion, for our discussion. As part of the audit of the Office of the Administrator of District Assembly's Common Fund, a team from the Audit Service has been tasked to confirm execution of works and supply of goods and services to your assembly and related transactions. The verification will commence on Monday, 26 July 2021. Take note, Monday, 26 July 2021, and expected to be completed by 13th August 2021. That's last week, 13th August. Please find attached a list of transactions, projects to be verified, and records required by the team for the exercise. Thank you in anticipation for your assistance to facilitate early completion of the assignment. Thank you. Signed, Samuel Boateng-Asare, Assistant Auditor General. And it has been copied to the Administrator, DACF, Chief Director, Ministry of Local Government, Head of Service, LGSSI, and they made Executive Director, though I'm not Executive, I'm CEO, for YE. This is our copy. Then you go to the appendices. Yes. For YEA point, it says youth in sanitation model. One, what they want to find is the list of personnel, supply of logistics from 2019, monthly timesheet, quarterly reports, and other records maintained by the Assembly concerning the execution of the contract. So my question is, has this work been done? That's the question I want to find out from Auditor General.
But as far as you are concerned, has this been done?
Because when you've done it, what you have to do, you have to write a management letter for us to respond. But can they tell us they've written a management letter concerning their 19th July 2021 audit?
So nothing has been done?
Nothing. We have not received any record. And per what you saw, the SI is supposed to be completed by 13th August. That was last week. So at what point did they collate all this information, brought a management letter to YEA to respond, and for them to issue the auditor's report?
So basically, these three issues that the Auditor General raised in the report, is it your understanding that you provided all the information, or did you not follow up to get the information that has found itself in the final?
Maybe they will be the best people to answer, because to the best of our knowledge, all the information that they needed was given to them. And it was based on that they were supposed to carry the audit exercise from 26th July to 30th August. And I have not received any communique from them. Yes, hitherto you could have asked for certain information, we're not getting, but eventually got them. And those information is assisting you to further go there and to check whether all those information that we have given to you is true or not. Aside that, you also have discussions between this office and the auditors. And is probably not the best, but due to the circumstance, I think I also need to read the discussion between myself and Mr. Sambo Boatin Asari. Good morning, sir. Please, we are preparing checklists for field verification of DACF payment, including your model. We, however, still do not have all the records we asked for. We are submitting a letter for the outstanding record, but we'll be grateful if you can ask your legal officer take phone camera images of the appendices to your 1st March 2019 and 3rd June 2019 addendum agreement and forward to us. Extremely grateful. So for someone to state that forward to us appendices to your 1st March 2019 and 3rd June 2019 addendum agreement, brief suffices that the person has the contract.
And this was done.
And this was done. And if you look at it, if you forward it, yes. So if you look at it, this is how it's done. You see Ashanti region document, Greater Accra, BA, Eastern region, Northern region, Upper East, Volta region, Upper West, Northern region. All those documents were submitted to them.
So if they are still asking questions, what possible conclusion can you come to? If all this information is provided, but they are still...
Well, I think, like I indicated, I have not cited the report. And it's a question that you have posed to me that I'm giving a response. So probably you can go back to them and let them know the information I've also given, to which I've provided evidence of even the discussion between myself and the auditor. And I've also shown you the contract documents between us and them. And also referred to their 19 July 2021 letter, which they stated they were going to round to do an exercise, which would have ended in 13th August. So our question is, have they given us management letter with respect to the exercise they went to date?
Mr. Live on The Pulse, tweet at us with the hashtag The Pulse. We'll take a break. When we return, health experts are expressing worry as COVID fatalities in the country shoot up in the last 3 weeks. Details of that plus new strategies to deal with this new development after this break. Welcome back to The Post. Let's talk about this dangerous pandemic called COVID, because health experts have expressed worry as COVID fatalities in the country shoot up in the last 3 weeks. The current number of deaths from the pandemic stands at 930. The Ashanti region has seen its COVID-19 fatalities shoot up in the last 3 weeks with 47 new deaths. We'll bring you more on the deaths in the Ashanti region. But first, let's examine the current figures. And I'm joined via Zoom by head of our health desk, Fred Smith. Fred, what's our current situation looking like?
522 new infections in the latest report released by the Ghana Health Service, and these are for events on the 12th of August. It brings our active cases to 6,004. The deaths, as you mentioned, 930. We have severe and critical cases at 174. The COVID numbers, as at the 11th of August, the day before, are the deaths 922. So in between that, we have 8 additional deaths being recorded in a day. Severe and critical also standing at 174, just like we had on the 12th of August. Now, the concern is about the deaths. We can have a comparison of the 2 months up to the 12th of August. And if you do that comparison, we had 790 on the 12th of June. That's 2 months ago. And we now have 140 COVID deaths more if we currently are at the 930 that you mentioned. The number of severe and critical cases have also shot up to 152. On the 22nd, on June, we had 22 cases of severe and critical cases of COVID. And then on August 12th, it's gone up to 174. And this is why the Director General of the Ghana Health Service yesterday at the news conference mentioned that we are actually experiencing pressure on the health facilities because more and more persons are coming to the facilities with severe and critical cases, and the result of the deaths that we are seeing.
Fred Smith is head of our health desk, giving us some updates of the COVID situation in the country. We can now hear from the Director General of the Ghana Health Service, Dr. Kuma Boaje, on the pressure on our health facilities.
Our treatment centers, yes, there's a lot of pressure on our treatment centers, no doubt about that. But as people get discharged, spaces are created, and that Ashanti initially was bad. It's a bit improved, and so it may be good today, may be bad tomorrow, but that's the more reason why we want to ensure that people don't catch the virus, and also no matter what you do, if we don't protect ourselves, all our beds will be full, and we don't even have enough health workers to manage them, because the health workers will also go home because they are exposed.
Let's go to the Ashanti region, because Ashanti region is recording increase in COVID-19 deaths, though infections are declining. And of course, the Ashanti region has seen its highest COVID-19 fatalities in 3 weeks, with 47 new deaths. The number of deaths continue to be on the rise, increasing from 297 in July 25 to 344 cumulative deaths on August 16, 2021. Regional Health Director Dr. Emmanuel Kojo-Tinkran told a weekly COVID-19 media briefing the situation should worry the public of the dangers of the COVID-19, especially in heeding to adherence to safety protocols.
For the deaths, you can also look at what is happening in Greater Accra. Greater Accra is even worse. One thing is that there's something that we all need to understand, that COVID kills. And a lot of people, because they are not seeing the deaths in their homes, they think that the COVID can kill. But the situation in our hospitals is quite different from what those in public are seeing. When you come to our hospitals, we get cases of COVID all the time. And unfortunately, we lose some of them. And those we've lost are those that have not been vaccinated, unfortunately. Those that were not vaccinated. In Ashanti, no. So you realize that if you are not vaccinated, you don't adhere to the protocols, and you get COVID-19, it can kill you. And from the data that you presented yourself, as at the second wave, our death was 299 or 96. Now we shot up to 344. It means that COVID kills, and it's killing not only in Ashanti, but also in all the other places. And throughout the world, I think it's well known. I believe that we've lost close to 4 million people from COVID globally, and Ghana is no exception. So that's the situation. And that is the message.
Let's speak with my colleague Ohimin Teria, who's been on the ground for us. Ohimin, we know that the Johnson & Johnson vaccination started last Friday. How is it going?
Ashanti region, 4 hotspot districts, and out of these 4 hotspot districts, we have 36 centers providing the vaccination to residents in these areas. The Regional Health Directorate is asking residents in these affected communities, which provides not less than 80% of COVID-19 cases in the region, to take advantage of the exercise and get vaccinated. He mentioned particularly that the new deaths of 47 being recorded between 25th July and today. Among them is a health worker who refused to be vaccinated. He says the person didn't take advantage of the vaccines at that time, and when he was got infected, he couldn't survive the COVID-19 pandemic. So Dr. Tim Kran is encouraging more people to be vaccinated. But one situation that is clear after I spoke to Dr. Tim Kran is that many people who were on the AstraZeneca dose continue to flood these centers to be vaccinated with the Johnson & Johnson. It's a situation that Dr. Tim Kran is not happy, and he's also asking people to desist from what he says could be a life-threatening situation. We can take a listen to Dr. Tim Kran.
Why I think we've had that report. Those who had the first dose of AstraZeneca are very anxious to get the second dose because they believe that the immunity will wane and that it will put them in a very big threat. But what we want to assure them from science is that when you take the AstraZeneca vaccine, at least when you wait for a period of about 6 months, even your immune system, when you get the second dose, is even better. So they shouldn't get scared at all because the government has made the necessary arrangements to get us the second dose. And definitely all of them will get the second dose. So all that we will tell them is that they should continue to exercise patience. So what we can assure them is that the second dose will definitely come. They will have it. So they should wait.
What more has the regional health director been saying with regards to contact tracing?
Yes, Aisha, the regional health director, Dr. Tim Kran, touched on the fact that there's been speculation which has been rife recently that health authorities have reneged, they've relaxed their efforts in testing and then tracing people who have been, relatives or friends have been affected. And he says that there's nothing of that sort. As far as the regional health directorate is concerned, they are now doing more and more scientific contact tracing than what they did. Initially, they were doing it on large scale. For instance, he says if somebody gets affected, at first they will come and then test all the people in that locality. But now they are not doing that. They have now diverted their attention to small spaces where these people live. For instance, if we live in a house, they will just concentrate on the household instead of going out to test the entire community. He says yes, contact tracing and then testing is still ongoing in the Ashanti region.
I think
we are doing more testing, we are doing more contact tracing, and that's the reason why we are getting the cases. In fact, if you are not testing and you are not doing contact tracing, you won't get any case. Yes. So the fact that you see us getting more cases and reporting more shows that the cases are being identified. And we identify all the cases through contact tracing. In fact, that is the only method that we use to identify the cases as at now. Previously, when it started, we were doing what we call the enhanced contact tracing. When we get a case, we just look at a certain radius and then go there and then test all the people there. That's quite different. We've moved to a different area now. What we are doing now is that when we get a case, we look at the contacts, the immediate contacts, and also test them. And I think from the second wave, that is what we've been doing throughout. So it's ongoing.
Ohime, what new strategies are they adopting to curb the increasing rate of infections?
Dr. Tim Kran highlighted some of the efforts being made by health authorities in the region. For instance, he talked about the fact that the Ebola being identified in neighboring countries, and he says the strategy in combating these conditions, the hemorrhagic fevers, are not different from the one being used to combat COVID-19 in the region. So health authorities will stick to the COVID-19 plan, and as a result, the old Bekwai Government Hospital has been identified as a public health space that in the event of any outbreak of hemorrhagic fever, the case will be transferred to the particular space. Now, there are also efforts being made by the Regional Security Council to encourage more people to adhere to COVID-19 safety protocols. He says that is still being enhanced with more public sensitization effort being made to encourage the citizenry, especially with regards to the hand washing and then wearing of face masks, so that people will continue to be in that regard. Now, more health personnel are also being trained so that they are able to gather information as quick as possible on some of these conditions, for instance, COVID-19, and then the hemorrhagic fevers, in order to control them as quick as possible. And beyond this, it's also, as a regional health director, to continue to rely on the support of the media in the region. He commended the media in the region for a good work done. He says, has it not been the effort and the intervention of the media, the regional health directorates wouldn't have, managed to control the COVID outbreak in the region so quickly and perfectly. So he elaborated on a lot of measures and also encouraging the citizenry to support the effort of health officials in order to bring all these situations under control.
Ohementeria is a man in the Ashanti region monitoring the vaccination exercise and also telling a situation about COVID-19 in that region. Well, here in Greater Accra region, patronage is picking up at various vaccination centers. Since the rollout of the Johnson & Johnson vaccine, the elderly are especially keen on getting the jabs to boost protection against COVID-19 virus, especially the Delta variant. Some of them have been speaking to my colleague, Messi Thompson.
I wish everyone will come and have it. I wish that they should not be afraid. They should all come and have for prevention. So I'm begging everybody to come and have it. Some are saying that they don't want to take it. Some are saying that.
Why are they saying that?
Maybe they are afraid.
Afraid of what?
I don't know. I don't know. But I wish everyone would come to have it.
So how did you hear of the...
They announced it 3 days ago. Maybe because of the festival. They have some function here. So they announced it on the speaker. That's why I came.
For me, I came here around 8:30. But the vaccinator wasn't around, so I have to wait. So we waited for about an hour. But as of now, everything is moving on smoothly.
Now,
Joshua oh, Mimi, electrician. Oh, through announcement and my TV, me share TV, me T radio, and on my announcement say vaccination me ever. There was a yes, we ever.
Now then, first one will be.
First one, and me two coin. Next way, you want to be a crabby sentiment me and what. The second one we buy and I say Debbie, I was say, with me a part of this vaccination.
I will urge each and every Ghanaian citizen to go and vaccinate because it's definitely going to be useful someday. Not now, but in the near future, it's going to be very useful.
Today being the first day for the rollout of the Johnson & Johnson here in the Greater Accra region, how has it been so far?
So far, it's been so successful. The patronage has been so good. The numbers have come. And we have also received all the needed logistics and the vaccines to give. So far, as now, we have vaccinated 100 persons this morning. And then we are still, you can see from the numbers that there are lots of people still here. The little challenge we have is just the entry of the data. The network fluctuating is delaying the data entry a bit, but we are still working on it.
How many people are still in line to receive the vaccines?
So far, we have issued 200 plus numbers. The number, we are 201 numbers that we have issued, and we vaccinated 100 already.
And how many days is the vaccination going to be rolled out at the center?
For 5 days, up to Friday. Every day up to Friday. Yes.
What are also your expectations moving forward? What do you expect to get better?
Everything is going on well now. So I'm just praying the numbers will continue. So what we received run out, then we'll be done with it. This time it's not as the initial one. They have understood it and they are really coming and asking for the vaccine, which is quite encouraging. That's what we were looking forward to. And we did a lot of social mobilization and announcements all over. And so we are not surprised that people are patronizing it today. So we are trusting that they'll continue coming in their numbers till we finish the section on Friday.
So there was also information that people who are within the district are the ones supposed to come for the vaccination. Have you had situations where people have come from outside the district to come to vaccinate here?
So far, not yet. Because we have the mobilizers going around informing them that we want those in the hotspots around the district to come. So they are the people coming. We haven't had any yet. We don't know whether by the close of the day we'll get people from other districts coming in here for it. We can't tell.
Away from COVID-19, traders at West Africa's largest grains market in Nigeria have turned to online trading to stay in business as COVID-19 stimulated closure of borders, slowed down activities there. The Daunao International Market in the Kano State has for decades been the sub-region's major hub for the buying and selling of rice, beans, millet and other grains. But the traders say the pandemic is throwing them out of business, but they are fighting back with new innovations in how they do their business. Joseph Opoku-Gakpo visited there and has filed this report.
So many countries in the world, not only one country, not only another state, no, so many countries in the world are coming here to buy the beans from this market. This one is taken to Port Harcourt, maybe from Port Harcourt, it is going out to another countries.
This is the Daunao market in the Kano State in northern Nigeria, and this is actually the largest grains market all over the West African region. Well, traders do come from all over the place, including places like Ghana, places like Niger, places like Cameroon, and they either bringing their grains, including maize, cowpea, rice, sorghum here to sell, or they come get some from here and take all the way to their various countries. Well, it's a renowned space for a lot of these activities, and as the traders right here are telling us, the COVID-19 pandemic with its attendant border closures has given them a lot of trouble in this particular enclave, making it almost impossible for them to send a lot of goods across the ECOWAS borders.
COVID-19, it comes with so many problems in terms of marketing. They are not coming from abroad.
Well, some innovation is being introduced. They've set up an online trading system that allows for a situation where, regardless of the part of West Africa that you find yourself, or even in other parts of the world, you only need to get onto an online portal and make a request for the necessary amount of grains that you want.
If you buy on internet, we can send it to you directly. Yeah.
So this market has been in existence for more than 46 years now, and mainly it's been an underground kind of market. But since COVID, things have been transformed to a certain extent. So traders from different parts of Africa can log on to their website, dawanoigm.business.site, which is right here, as you can see. And then it tells you till when they actually open. So here it's telling you that they are open till 8 p.m. And then when you get onto the contact us section, you can key in your name, your phone number, your email address, and then state your specific request, including how much grains you want, which country you want it delivered in, at what price. And then someone will reach out to you, make the necessary arrangements, payments are done, and then the goods get to you.
Yes, it's helpful for our business, but it's we are starting it just last year ago. It's gradually. Yes, just you can go and click Daunao International Grains Market Traders Association. You can connect with us.
the COVID-19 pandemic has obviously brought some difficulty onto the work that the traders do here, but they are innovating in order to continue staying in business, even as efforts are made to deal with the COVID-19 pandemic. Well, from the Kano State in Nigeria, my name is Joseph Opokugapo.
I'm back here in Ghana in the studios at Kokomlimle. My name is Aisha Ibrahim. Joseph Opokugapo now joins me live from Nigeria on Zoom. Joseph, tell me more about this online business, because I know a number of the traders are technologically bankrupt.
Precisely. So from the explanation the traders give us, there is someone who manages the details that eventually get onto the site when anyone tries to engage them as traders and gets onto their site and key in the details in terms of how much purchase they would want to make. And that individual will then, gather those details, and it's from that said manager of the site that the traders then get the necessary information on how much is needed by someone else from a different country and how the items will be transported. And also that help is coming from the leadership at the market in order to ensure that even the farmers who are not technologically savvy are able to get the details on necessary requests that have come on that particular platform, as far as requests to export necessary grains from Nigeria to those specific areas are concerned.
Gakpo, how long or how far do they intend to take this?
They make the point that this is something that they are pioneering following the COVID-19 outbreak situation that we saw, and the closure of borders. As we all know, even within the ECOWAS sub-region, only goods are allowed to go. Human beings are not allowed to cross the necessary borders. Although we know a bit of that is happening here and there, the traders make the point that this is something that they would want to take advantage of going forward. It's not as if when they see a situation where the COVID-19 cases improve and the borders reopen, they will abandon this latest innovation that they've introduced in order to make their businesses thrive. They are looking forward to rolling out a system that would have a mix of both the situation with the online trading plus in-person trading eventually when the borders open. So they are not abandoning this particular process anytime soon, even after they introduced it thanks to the COVID-19 pandemic.
So what other challenges do these traders face, due to the COVID-19 pandemic? What have they been telling you?
So they make the point about the border closures, which they say, particularly sometime last year, really negatively impacted their activities, because this is a huge market. The Dawanau international market is a huge market that would usually have traders come there from different parts of the West African sub-region, including Ghanaian traders. So one interesting detail I got was that virtually on a daily basis, when business was really good and there wasn't the COVID-19 pandemic, at least 20 trucks on daily basis leave this particular market for Ghana, carrying either cowpea, maize, or some other products in order to go feed Ghanaians. And the traders make the point that all of that has slowed down as a result of the COVID-19 pandemic. Currently, not a lot of respect for COVID-19 protocols are happening in that particular enclave, although they make the point that they try to then do that even as businesses open up slowly. And they make the point that one way or the other, the closure of the borders has really slowed down businesses, is increasing their cost to a certain extent. And that is what has pushed them to want to innovate. And they really make the point about the need to immediately reopen the borders to avoid a situation where their business will eventually suffer even more damage as a result of the COVID-19 pandemic.
Gakpo, when are you coming back? Because I miss you a lot.
I miss you a lot, Aisha. See you in the next 2 days.
My colleague Opokugapo there reporting from Nigeria. Now, the National Road Safety Authority has been established by Act 993 in 2019 to replace the National Road Safety Commission as the lead public agency for road safety improvement in Ghana. The authority is mandated to develop, promote, coordinate, and regulate activities, procedures, and standards related to road safety. How different is the authority from the Commission, and what is the new agenda for road safety improvement? We have a representative from the National Road Safety Authority to help us reflect on the new mandate, new agenda, new expectations of the authority, and how the new agenda helps to address the challenges we have with road accidents and related problems. Don't forget, we are premiering our documentary Crashed Young at 4 p.m. today in Kumasi. And so Head of Regulations, Inspection and Compliance at the National Road Safety Authority, Mr. Kwame Kodie himself, is here. Good to see you.
Aisha.
So what has changed from commission to authority? What's your new mandate?
Well, thanks a lot. Beyond the change in name, there's a change in expectation. When we were a commission, our prime objective was to promote road safety, raise the issues of the risk associated with crashes, increase public awareness with a view that the public will be informed and make appropriate choices. Becoming an authority, the law sets out a clear objective for us, which is that beyond advocacy and improvement in knowledge, the expectation from the law or legal standpoint is for us to reduce the incident of crashes and the associated deaths and injuries. So in the past, we're going to be measured by the extent to which the public have become aware of these factors. And indeed, if you go back to look at the indicators today, the level of awareness have gone up from less than 40% in 2006 to about 85% in 2019. It means a lot have been achieved in that regard. But that alone is not enough. So the new mandate begins to demand of us to do more than we did the last 20 years, if you like. So one, beyond our traditional mandate, this new arrangement requires that we regulate safety standards. What that means is that we have the opportunity, if you like, to demand more responsibility from our stakeholder institutions and be able to sanction those who fail to act in accordance with their own standards.
Let's look at the object and target of the law that establishes you. What exactly does it seek to do?
So the object one is that we must be deliberate about reducing the number of crashes and their resultant deaths and injuries.
Okay.
The law requires that we do so by promotion of road safety, by developing and coordinating road safety measures, and by also implementing and enforcing road safety standards. I said, in the past, as a commission, the object was that we should increase safety awareness, do a lot of sensitization promotion, without too much emphasis on reduction. But now, the policy objective of the law is that we must reduce these incidents. And to do so, in addition to all the things that we used to do in the past, the additional responsibility is for us to regulate road safety standards. By regulation means that we must find ways to ensure that existing institutions that have been given one responsibility or the other are implementing their own standards. The second point is that as a regulatory body, the law requires that we pay closer attention to the commercial road transport sector. For the life of this country, we haven't done as much to exert control on who comes into that space and who exits. What we do in the road environment is not any different from what happens in the airspace. But you would agree that it is not quite easy for anybody to begin to fly our airspace with an aircraft. The reverse appears to be the case, that in a road environment, it is pretty easy once you have the resources to put a vehicle on the road to provide public service. Those gaps, out of painful lessons learned over the years, requires that we must begin to look at things differently. And the new expectation, the new object and agenda requires that we must begin to pay a much closer attention to the sector. We have said again that beyond the driver and the vehicle, the road is an important element in the road safety conversation. A good road will not necessarily mean a road that is asphalted. So it could be flat, straight, but toxic because it does not have the necessary safety facilities. There are agencies of states that have the primary responsibility to keep our roads in good condition. If you look at what we've done the last 20 years, every year we try to mirror what we call the 20 most accident-prone locations across country. But the responsibility does not rest with us to fix the roads. In the past, there were very little we could do as far as that expectation was concerned. Going forward, we are required to collaborate with the road agencies and devise procedures that will ensure that existing safety protocols that are known to all of us will be implemented with a view to minimize the risk associated with the quality of the roads. This comes with sanctions, which we were unable to impose before.
Okay.
The new expectation gives the opportunity to issue notices, issue sanctions when the need be, all with the view to try to build a certain culture where institutions will prioritize safety and voluntarily carry out their function, just so that we can begin to minimize the risk associated with use.
So the Act, does it provide framework for implementation of these standards?
Yes, so the Act requires that we should develop regulations in the form of legislative instrument.
Okay.
That's being worked on. Unfortunately, because of the sad realities of COVID, not much was able to be achieved last year. But this year, it's gone to the Auditor General's office. They've made comments on 2 occasions. And we are working very hard to ensure that when Parliament reconvenes sometime in September, we'll be able to lay the regulations to define the procedures on the way we want to proceed on these matters.
And when there are breaches, I mean, what are the provisions in the Act as to how to deal with these breaches?
Okay, so the first opportunity is for us to issue compliance notice.
Okay.
In the past, we would have written to offending institutions and try to advise that one step is taken or the other. One step or the other is taken. Now, the law requires that we issue a compliance notice. The force of it is that if you fail to act on it, there may be consequences.
Okay.
So typically, if there's a safety threat which must be remedied by an institution, the notice will indicate the threat, will indicate what must be done, advise on the time to do it, and also indicate the consequences for failing to do it. That is one. The second is that where there's a failure by an institution to carry out these directives or notices, the authority may have the choice to secure an enforcement order, which is to get the court to add its voice to ensure that the said directives are carried out for public safety reasons. But ultimately, there's opportunity for the authority to issue administrative sanctions, which may come in the form of administrative penalties, more like fines, except that they do not go to the consolidated funds, but that will go to support the authorities' activities. These are opportunities that were not in existence when we were a commission.
Okay.
And so becoming an authority, these are the new add-ons that the law creates in a bid to ensure that institutions do their work. Ultimately, from the institutional point of view, you want to see the authority as ensuring institutional compliance in addition to its public advocacy role. So taking road safety education. In fact, the law requires that in addition to what we have done in mainstreaming road safety up to basic levels, we should begin to look at secondary schools and pre-tertiary institutions. But In our dealings with our stakeholder institutions, this law provides the expectation that we must hold them accountable to their own standards, so that the sort of actions that are required of them to be implemented, which are found to be beneficial to the vulnerable road user, they are implemented for public good.
Okay, and I'm happy that you talk about moving from commission to authority means, there's an additional mandate and also to improve the system. How does that act improve transport operations generally?
Yeah, so the act requires that we regulate the transport sector. So what it means is that the transport service providers are going to come under some permitting regime. In fact, they do a certain limit of it at the assembly level. So we're looking at how to collaborate with the assemblies or local government service to ensure that the operating permits that are issued, and I say this to be permits to the transport companies. They are not directed at the vehicle owners or individual drivers.
Okay.
So the STC, the Metro Mass, the GPRTU, the Proto Pega, and their likes would have to come under a new permitting regime, which will require that the authority takes interest in the quality of vehicles that they make available for their service, their operational plan, the quality of drivers, and their continuous education, and essentially standards that go to limit the risk of passengers. Of course, whilst these conditions have been defined, the permits are renewable, so that if you fail to act on the terms of your permit at the point of renewal, there may be consequences for you.
Okay.
We think that kind of arrangement, which exists in almost every country that do not often have this discussion, must be replicated. But we must do so in ways that do not create too much discomfort, but must be done nonetheless.
What has been your challenge in dealing with offending institutions over the period, and how will this new law help in filling the loopholes?
I'll give you a typical example. I think one of the sad reality of present is what happened on the N1, for instance. So when the N1 was being constructed, there's what we call a road safety audit, which is an opportunity to review the design and make appropriate recommendations.
Okay.
For many other road infrastructure work, for instance. In the past, when these recommendations are made, they come in the form of an advice. And advice may well be taken or not. And oftentimes, not all the time, oftentimes most of these advice have not yielded the necessary consequences from action, if you like, from the relevant institutions. And the issue of the N1 is clearly there for us to see that in many cases we've had to come back to take rather late remedial actions that could have well been avoided at the point of inception. What this arrangement does is that when the authority issues a notice or a directive, which is based on what an institution ought to have or to do naturally,
okay,
and there's a failure to do it, the law empowers the authority to ensure that it is done. So not more like an advice.
Okay.
In the past, it was more like an advisory agency, but as a regulatory institution, what must be done within the context of the law, we must find ways to ensure that it is done for public good.
Okay. So with this new thing, it also means that you have additional mandates and also to ensure a better road safety situation in our country. Do you have what it takes?
Yeah, well, Rome wasn't built in a day. We've been asking for this for close to about 10 years. Yes, I think at present we have sufficient capacity to begin to implement the new expectation. The law provides that we set up a new directorate in charge of responsible for regulation, inspections, and compliance, which has been done. the law requires that we appoint some road safety inspectors. And last year, we did appoint about 100 of them across country. They have been trained. We are continuously giving them some level of training. So gradually, we are beginning to build a capacity to respond to these new expectations. From the beginning, we do not expect to be fully ready from a go.
But do you have a plan?
Yes, we do.
Okay, what's the plan?
The plan is that we've set up a new directorate. As I've said, we have employed about 100 inspectors. The entire body of the authority, human resources, are beginning to go through some level of training to align with this new expectation. We have plans to roll out the legislative instrument. Hopefully, if it should come to stream by the end of the year, to add up to the new demands. We are harmonizing existing standards into a single document that will be referable for all of our stakeholder institutions and gradually carry out a lot of sensitization. In fact, between last year and this year, what we have tried to do is to bring as many of our stakeholders together. We haven't as yet begin to exact the level of control that the law requires of us, but we think for starters, those that would be hit, if you like, by the law, to be fair, must begin to appreciate what is required of our relationship. So that when the other needs come to stream, the LI, the standards manual, staff sufficiently trained, from next year, hopefully, the authority, the public will begin to see a new look of the authority.
Mr. Tuahin, I'm grateful for your time this afternoon. He is the head of regulations, inspection and compliance at the National Road Safety Authority. Of course, like any other day, she had seen her 2-year-old daughter off to school. And Naomi Ado, who lives in a slum near the Graphic Road, expected the little girl to return home safely in the company of her schoolmates. But the story was different. While returning home, the girl was hit by a vehicle and run over by another. This is one of the many stories in the latest edition of the JoyNews Hotline documentary titled Crushed Young. Producer of the documentary, Setkwam Boateng, shared this excerpt.
Today, I am out on the Graphic Road here in Accra to meet a young woman who has been a victim of road traffic accident. She is called Naomi Ado. She lives around the Graphic Railway slum, 600 meters from the Graphic Road Highway. Tears build up in her eyes, and even before I engage her, she breaks down.
Because many that's why I'm a see that you baby papa be and they are shaming you. And to miss me, you home. I'm assuming in the course. See that she be obey at the papa be mamma, so in a bachelor, Uncle C. Aga. On a many year maybe be a babbit or friend auntie Naomi, or friend mad. They be auntie Naomi and the one on the flame. Meaning a DG, meaning be a balance and a D, Mammy Ancassa.
On that day, Naomi saw her 8-year-old Class 2 daughter off to school, hoping they would reunite later in the day. This, however, became a mere wish.
Baniku school, until all bano, and a traffic light in Ejuma. Until you know when we say into all trim, not cabin so every overhead nisu, sunny, until a born and a rush in the hospital, and in the hospital, you drew on. I say.
On that day, Naomi was so sick that she wasn't able to rush to the Kolebu Teaching Hospital to see her daughter.
On that catcher, we collapse here. It is Benitiana, behind an hour for, and I'm beside, and I must you see. Zuman in the Benicia may collapse here.
When the first car hit her, a second one ran over her at the Graphic Road traffic light intersection. According to hospital records from the Kolobo Teaching Hospital, her pupils had dilated and was bleeding from the nose and mouth by the time they reached the hospital. She also had a deep cut on her forehead. Her dream of becoming a journalist ended right there.
When we start mentioning children in this society, children from this level of society and what their loss means to their families, then we probably will start sitting up. For example, if it's an only child, for example, if it is a child born out of so many years of trying to have a child, or a child.
It's been 4 years.
We are to extract stories from these children who have gone through these difficult times. We are to hear that of Moses and Peter. And Moses is the reason we did this documentary. He's the inspiration, because it was his story I chanced on that made me go further and come up with this documentary. So the pain they are going through, the psychological impact of this on them, the effect on them. And for example, Moses is wondering how he could go back to school, and he's been asking the mom, so am I going to be in a wheelchair and go to school, knowing very well that in my school, I was an athlete, I led the school parade, and at church, I played the church drums. So he's been wondering how he's going to survive when he's discharged from the hospital. And it's painful. Then when we hear of Peter as well, and I got to know Peter through Dr. David. They worked on Peter, so he can tell you a lot about Peter and how they found Peter the first time that Peter was brought to Community Teaching Hospital, how this young boy, who was 6 years then, was sent home to collect 3 cedis as studies and preaching fee, got knocked down and was amputated. Both legs are gone. These are harrowing stories from these children in Israel.
At times, it's difficult for relatives to even know that these children were with their parents and they got involved in an accident, and either the parents died or the child died, or what's happening to them. At times, you get families here and come for these children, take care of them. At times, when it involves only children, and I said earlier that from this, I got to know that there are quite a number of children who have died through road traffic accident. Israel, presently, some are in the mortuary. Nobody knows that they have been hit and they were killed and they are in the mortuary. So at times we hear that a child has gone missing, and we run an announcement on radio, on TV, parents looking for that child. They don't hear from them. They don't see them. At times, you also hear from the police tell us that they are about doing mass burial. So if your child is missing, you can't find your child, and you've heard that the police is going to do mass burial, I would advise you better go to that mortuary and search, because there are children like that, and there are some who have been mass buried because no family member showed up and they were buried.
That was Seth Kwamboatin, the producer for our documentary Crushed Young. It will be premiering in Kumasi, and it's a story about how many children are losing their lives to road accidents. We'll take a break on The Pulse. When we return, there is more.
You're still here on Pulse, and it's time for a big dose of sport. It's time to talk about some of the biggest leagues in Europe, specifically the Spanish La Liga. Within the Spanish La Liga are the Catalan giants Barcelona, who are living life without their talisman, Lionel Messi, who completed a move to French giants Paris Saint-Germain. Now, there's been a lot of talk about how the Catalan giants will be coping and will be looking like this term without the man who brought them so much joy and helped them to make massive achievements in club football. Well, can Antoine Griezmann, Ansu Fati and Dembele fill in the void that has been left by the Argentine captain? Well, these are very big questions that we want to pose to some fans, and this is a conversation that we'll also be carrying on to Fan Zone later on tonight with Hans Mensah. But for now, let's get on to Zoom and have a conversation with Veronica Owusu-Osei, who's a Barcelona fan. Hi, good to see you. I love the hairstyle and I'm loving your jersey as well.
Thank you so much. Good to see you too. Thanks for having me.
Great, Veronica. Now, let's get into the conversation. First of all, once there was kickoff for this season and that game began, did you miss the Lionel Messi factor? Even though you've had days where Messi has been, injured and absent in the side.
Yes, I did really miss the Messi factor. Messi being out of our team, it was like a big blow, but I think we have no choice now than to live with the situation. So, yes, I did miss it, but I think it's really time to move on. So, it's good. It's all good.
Conversation we're going to continue later tonight because there is some breaking news coming in. But just quickly before we wrap it up here, I want you to tell me who you feel can fill that void very comfortably, especially with what we saw on the first day.
I feel right now we have a lot of players, and I think we have a lot of talent, and we are hoping that if Ansu Fati gets back, he could step up and fill in some gaps for us. And I think with the talent and the diversity that we have now.
This later tonight, on Fan Zone. But thank you so much for the time for now. So we'll cut it for now and then we'll come back later in the evening. Thank you very much. Veronica Owusu-Osei is a Barcelona fan. What we do is to have the conversation with those who follow the club so religiously. Well, right now, however, we'll cross over to the Garden City, Kumasi, where my colleague Seth Kwame Boateng's newest documentary, Crushed Young, is being premiered.
For this great documentary, we commit our ceremony into your hands. From the start to the end, we pray that God, you lead us, that at the end of the day, your name be glorified. We commit everyone over here into your hands, the regional minister, ministers of states, and all other stakeholders. We pray that, Lord, as we view all these, grant us the wisdom to make our nation better and stronger. Let your name be glorified. This is our humble prayer. In the name of our Lord Jesus Christ, have we all prayed? Amen. Shall I please take our seats?
Well, I believe we can put our hands together for Pastor Patrick Owusu, head pastor, World Spring City Church. I know that you're comfortably seated and you're eager to see this work put together by Seth Kwame Boateng and, of course, his team. I'll plead with you at this point in time to mute your mobile phones. Either you put them on vibrate or you put them on silent. Please do that for all of us. So when the premiering starts, we'll not be distracted. Now, we'll be acknowledging most of you because we're compiling names, but I can see our very own Honorable Regional Minister Simon Osei saying now. Make a round of applause for him there. Thank you, sir, for your time. Fortunately, there's few people I haven't seen in God knows how long, but I've seen some here this afternoon as well. Let me also acknowledge, the presence of Dr. Ernest Kwaku. Doc, good afternoon to you. Thanks for your presence. Randy, I see you as well. I know there's a very special gentleman. He's called the Legend Silver Ken. Good afternoon to you. And all of you are most welcome. I can see my mom as well, Mrs. Teresa Jackson. Good to see you. A round of applause for her. She's a lovely person. Before we start screening and rolling this documentary, ladies and gentlemen, we have a few words for you. At this point in time, I'd like to invite to the microphone a very special gentleman. He keeps us on our toes all the time. He has a head similar to mine, very brainy. He's our general manager. Ladies and gentlemen, to give to us a welcome address, Mr. Jimagla.
Good afternoon, ladies and gentlemen. Mr. Chairman,
The Honorable Minister, members of Parliament here present, Nananum, invited guests, members of the press, ladies and gentlemen. On behalf of the Multimedia Group, I welcome you to this all-important premiering of the JoyNews documentary, Crashed Young. Like our MC David said in the beginning, the carnage on our roads continues to be a worry, and the figures are indeed alarming. Please permit me to share a few statistics on the subject. Over 1,700 lives have been lost in road accidents between January and July this year alone. The Ashanti region currently leads with 357 lives in the number of people killed on our roads. The region has also recorded over 400 pedestrian knockdowns since the beginning of the year, which happens to be the second highest in the national figure of 1,740. Ladies and gentlemen, it is therefore no coincidence that the screening of this documentary, focused on the impact of accidents on children and families, is happening in Kumasi here today. Instilling safety on our roads is therefore a collective responsibility. For us at the Multimedia Group, we will continue to pursue this as part of our mandate to inform and educate our audiences towards promoting appropriate behavioral change among all road users. This documentary should prick our collective conscience as a people to begin acting right to save lives, including the lives of all of us gathered here. We appreciate you for coming to join us today for this premiering and hope we have fruitful discussions after watching this amazing production from our multiple award-winning journalist, Mr. Seth Kwame Boateng. Thank you very much for honoring our invitation. God bless you.
Oh, I'm sure we can do better with the applause. Jim Agla, General Manager, Multimedia Group Ashanti, and we're talking about Love 99.5 and of course Insura 104.5. I can see MP for Juso here with us. He's also the Deputy Finance Minister, Lawyer John Kuma here this afternoon. Thank you, sir, for your presence. Fine gentleman he is. And of course, Dr. Stephen Ampua is also here, MP for Insha. I saw him a while ago. I don't know whether he's on Ekosi saying. But ladies and gentlemen, in no time, we shall be rolling this documentary for you. Before we do, let's welcome to the microphone our very own Regional Minister, Simon Osei-Mensah. He's got a few words for us. We want to play safe, so let's sanitize the microphone.
Thank you very much, Dave. Honorable Deputy Minister for Finance and MP for Echoso, the CEO of Multimedia, Nananom, Queen Mothers gathered here, ladies and gentlemen, it is with joy, a lot of gratitude that I join you this afternoon in the premiering of this work by Seth Kwame Boateng, my nephew. In one of these exercises led to the First Lady, Her Excellency Rebecca Akufo-Addo, to construct mother and child unit at Komfo-Anokye. Where we saw about 6-8 babies in the same room or environment, and for that matter, contracting various types of diseases leading to high child mortality at Komfo-Anokye. But with the work of Seth, now we are proud to say that the mortality rate at Komfo-Anokye has drastically come down. Consequently, I'm of the strongest conviction that what he is going to premiere this afternoon will also bear fruits. I'm urging all media personnel to try as much as possible. I know we have different potentials, different specialities, but we should try and emulate the work that Kwame is doing for Mother Ghana. He's selfless, he takes the risk, he uses his time and other resources to do this, to unearth some of the problems, the fundamental problems of this country. Let me give small statistics. If you take 2019, through road accidents, 33 children, that is under 18, pass on to glory. Unfortunately and seriously, 2020, it increased from 33 to 40. And worse, because the year is not ended. 2021, as at the end of July, we'd reached 60. So we can all imagine the dangers associated with road accidents and the effect on our children and our families. When you take the children, the adults who are losing their lives brings untold hardships on the surviving spouse and children. Most of these people are the breadwinners of the families. In their absence, nobody knows what happens. I have suffered because my mother was a single mother when my father died in 1969. And my mother had to take care of us alone. And I know the difficulties we went through. I don't wish any child to go through that type of life, because not all can survive under such conditions. Thank you very much, and I wish we all pay attention to what is going to be premiered so that when we go, we will be good ambassadors. Thank you.
All right, so I think we can do better with the applause for the regional minister. Thank you so much. In about 2 minutes, we'll all be feasting our eyes on this projector to see the work done by Seth Kwame Boateng. That'll be in roughly 2 minutes from now. But regional minister, I'm disappointed though. I didn't say some regional minister. Me sure him cry na akwahame. So said what? Kwame Boateng is your nephew, and you said David. No, you give me a daughter to marry, so I become an in-law. I don't want to be a nephew, I want to be an in-law. But all the same, thank you very much, sir, for your presence. I can see the DVLA boss in our midst, Mr. Abakan is here. Good afternoon, sir. Thanks for your presence. And to all of you, to all Akwe mothers, we salute you. Now, per the statistics given to us by the Ghana Police Service, each and every day here in the Ashanti region, at least 13 people, 13, get injured as a result of road accidents. And each and every day, roughly, 6 lives are lost. So it's just roughly some 12 minutes to 5. By close of day today, lives would have been lost. In the country, we're told that at the end of every year, 310 lives are lost by way of children in terms of road accidents. And each and every day, nationwide, 6 children lose their lives. Again, it means that by the end of today, little ones, many a time through no fault of theirs, would have passed on to the next world. We all have a responsibility. And I pray that after watching this documentary, we'll put in the right measures to ensure safety for our children on our roads. Ladies and gentlemen, it's on time for the documentary dubbed Crushed Our Children. Please enjoy.
So, of course, this documentary will be airing at 8:30 p.m. on the JoyNews channel. Do make a date, and that's how we wrap up the Pulse this afternoon. It's been super exciting being with you for the past almost 2 hours. Let's talk showbiz. It's up next. Enjoy the rest of our programs.
Girlfriend just to take my heart to play. I catch on pie, but she say it's just a game. I feel my head by side, I don't know what to say. What to say, In the other cry.
Okay, well, you know, because you see, to spot the talent, and guide the talent through the times. It's not easy because the talent alone cannot make it. You know, so for me, then I'm going to give all the praise to K1.
But then I'm going to go to my first question now. What motivated this project?
Okay, so initially we were working on an EP, right, with my team, and then we're like, Charlie, but we've worked so hard, right, and we feel like the people deserve even more. We can't just do like a four song, EP and then just release it. We need to give them more. So I and my team decided that, you know what, let's do 12 instead. Shouts to Papa Kewa as well. He's over there by hello.
Papa Kewa, yeah, come on, someone.
Me patrol me ciao.
Papa no more in here.
Well, I think that it brings me great joy, and I feel blessed. I feel blessed that when we began, we knew where we were going, even though the path was a bit unstable. We're here, and I always say that this is our starting point, because this is where I want us to get to so we can fly. And so I didn't produce any song on the album, but I mixed and mastered the album. And listening to the album song by song, I feel this is one album Ghanaians should actually look for. There's almost everything you want to hear in the album, and that's why it's called Alpha. So just go get it. Great production also from all the young producers out there.
Are you feeling the boy? Cause I go fit you better. I go fit you better. Make I love you better. Yeah. Beautiful, oh my, baby, beautiful, oh my.